Hey, folks, if you want early access to episodes as they drop, click that subscribe button, join us, and together we'll fix the broken U.S. healthcare system. We'll see you on the next one.
Get ready to take control of your healthcare. Here's your host, Ray Cobra.
And we're live, ladies and gentlemen. Welcome to Broken Healthcare. My name is Ray Cobra. I am your host, and I am delighted to be joined by the fellas from Angle Health. Great to have you both in the studio. We have David Slepak. We have
Caleb Parker.
Caleb Parker. I told him I was going to fuck that up. So it's Caleb, not Caleb. Caleb Parker. And hey, welcome to the big show, guys. Great to have you.
Yeah, thanks for having us. We appreciate it.
100%. So Angle Health, I want to learn all about that. But before we get into the actual company and what you do and who you are and how you're going to solve the world's greatest mysteries, I'd love to hear from you guys. And I know, if I'm not mistaken, David, you do podcasts on the regular. So you're kind of a professional. Tell me a little bit. Why don't we start with you, if you don't mind? Tell me a little bit about your journey and how you got here.
You know, it's interesting. I cut my teeth in the health insurance business as a State Farm agent.
Wow.
And I was in a study group, interestingly enough, with a guy. And he said, you're prospecting for customers. No one needs better car and auto insurance. But what they really need help with is medical health insurance. He's like, start prospecting. And at the time, State Farm had some individual products and whatnot for health insurance. So I said, okay, let's do it. So I learned everything there is to know about the individual marketplace and health insurance and whatnot. And it worked, right? It worked really well. And I said, how do we do more of this? And you know, I'm business people in kind of the Phoenix metro market where I'm from. And I wanted to start writing more group type stuff. And that's actually how I got into this industry, right? Which was pretty amazing, pretty amazing stuff. And it's, I fell in love with it. And there's a personal mission around it, right? Trying to solve things and deliver access to care.
Yeah.
Right. In an industry that, you know, has been really challenging for a lot of people, a lot of businesses, a lot of individuals.
Very interesting. So what was the journey like from State Farm to Angle? Like, how did you, were there many steps in between?
Lots of
road?
steps. Lots of steps. Yeah, lots of steps in
is.
between. I've been here at Angle for going on almost 2 years now.
Okay.
But I've worked in lots of areas of the health care and health industry.
And
right?
your official title is?
So I'm the Vice President of Sales and Marketing.
Okay.
Here at
sales
Angle.
guy, folks.
Yeah.
Be careful. Be careful.
It's funny. You know, I characterize myself as a marketing guy that knows how to sell.
Okay.
Right?
Yeah.
And a sales guy that knows how to not wreck a brand. Right? Very important.
I love the way you put that. And I think the truth be told, if you're one of the good guys, you shouldn't be selling anything, right? If you're working for an incredible brand, a brand that really puts the client first, client, to use a J. Abraham term as opposed to customer, right? Our clients. You're not really selling, you're educating. And through that educational process, they are then coming to learn about you. And once they develop a comfort level, if it's a fit, they're going to move forward. So I think sales is more difficult if you're selling snake oil, way less difficult if you're selling gloves and hats to folks in Alaska, right? Then we have a need, as opposed to just pushing something that you probably shouldn't push to begin with. And hey, do I need this? Do I want it? Why should I care?
Yeah.
And as a consumer, I think you could almost feel that pull, right? We've all been there. You've all been pitched. I get pitched every day, right? And the question is always, well, this should be something that feels like a natural fit, something that I want, as opposed to you telling me how wonderful you are. And so the whole idea of this show is not to ram anything down our audience's throat. It's real. We created an environment where, as I told you, as I get to know you, the audience gets to know you. And if what you have if your journey, if your product, if your service resonates with them, the sales part, that should be the easy part. And what you do is very different at Angle Health. So it's not easy to be sure, because this is a very crowded space. After all, you're putting together health plans, and you're fighting for your share of a market that, in a very, very, very crowded marketplace where there's a lot of confusion, there's a lot of, hey, what exactly do you do? Why haven't I heard about you? Who are your clients? I'm sure these are all questions that you get every day. And so maybe you could kind of take this and just kind of tell us a little bit about Angle and what is the number one question that you get asked about Angle?
Yeah. I think the number one question is the easy and obvious, right? It's the why, right? Why would I choose a brand that doesn't have a blue logo, right? And to some extent, that's also where we emphasize that what makes us different is that the lack of difference is what makes us different, right? And what I mean by that is, we're in an industry where it is crowded, to your point. And much of that crowd is ultimately brought about by everyone trying to, quote unquote, reinvent how people access healthcare or retrain how people access healthcare or retrain how they purchase it. And in reality, most people want to, as David would say, plunk down a plastic ID card and see a doctor, right? And that doctor knows how to process that plastic ID card. And they just want it to work, right? And at the end of the day, we often say, people don't have bad benefits. They have bad benefits experiences, right? And it's often a misalignment of expectations. They expect, they pay premium, and then they expect, their office visit to cost X, their hospital visit to cost Y, or perhaps they expect it to cost nothing. And that's ultimately, again, kind of back to the why of Angle. The why of Angle is just make it easy, right? Make it easy and match ultimately that expectation with the experience. And so rather than reinventing how to access healthcare, right, or how to purchase healthcare, our solution is make it easy, right? Deliver ultimately the expectations of the member, the employer, the broker, and provide a service and a solution that is truly a better experience for all parties around.
Interesting. So let's dive into that a little bit. When folks who are listening, driving in their car, on a run, at the gym, doing what they do, vacuuming, or maybe watching this on YouTube, there's a very, what is the word I'm looking for? There's almost this stigma around that ID card.
Yeah.
And that people believe that their insurance is as good or bad as the logo on that ID card. And eating and drinking and breathing this stuff for the past 8+ years, talking about self-funded health plans and plans that are outside of the norm, right? If we're talking about alternatives to the status quo, what I've learned is that nothing further can be from the truth. And yet it's the most difficult message, I think, to get across. And I do agree with you completely that it is about the member experience, right? Because, but here's the tricky part. You have to be in it to have the experience.
Of course.
And if you're not willing to take the leap and jump in it, well, you have no frame of reference. You can't have the experience.
Sure.
And so that must be a challenge for you guys. And before we get into how you overcome that, I'd like you to share with the audience, every health plan out there, when you have health insurance, it is essentially a stack, right? It has lots of different things embedded in it. It has pharmacy. It has typically a provider network. It has, gatekeepers in some cases. There's a bunch of stuff that's baked in. Does that go out the window when someone comes over to the Angle Health Plan, or how exactly does it work?
Yeah. I think it doesn't go out the window, in short, right? In that ultimately, when you think of a health plan, right? It has all of those components, right? It has, a network, right? Because in the end of the day, people like to look up, right, how to find their doctors.
Yep.
And so, to some extent, the network satisfies that experience, right? People like to be able to, go online and check what pharmacies are in network, right? They like to ultimately find out what their expected costs are because they found that familiar for them, right? And so many of those pieces and parts that you mentioned are there,
Yeah.
right? What makes us unique here is that it's fully integrated with flexibility, right? You're not beholden to this angle network or this angle pharmacy solution, right? It is truly a vertical stack, but a modular one in and of itself at the same time. And maybe, David, you could add to some of that.
I've spent most of my career in the health insurance world kind of waving the flag of disruption. We're going to burn the place down. And we're talking on the pharmacy side and discount cards. And I did a little stint in reference-based pricing. And at the end of the day, I learned something pretty interesting, right? As Caleb says, people understand the familiar. And for a lot of people, it's working out really well, right? The status quo works pretty good for most people, the way it's supposed to work.
Yeah.
And whether that be a network or, even on the provider side, they're familiar with how the system works. And what I've learned over the last several years here at Angle is as we kind of think about the, kind of status quo and the familiar, keeping that intact, keeping the structure of a vertically oriented solution is really important. But then leveraging technology, right? So, I think one of the unique core capabilities that has been missing in this market is using technology kind of behind the scenes. And I often refer to it as front stage and backstage, right? So front stage, we produce a proposal just like everyone else using a census. But behind the scenes, we've done some really interesting things on the technology side to make that happen, right? So there's little things like that, being able to customize plans.
Well, can you expand on that? What do you mean? What are you doing differently than your typical TPA, for example?
Sure. So, one of our core competencies and where we see, people want quotes fast. People want things easy. They don't want to have, in the traditional space that we play, we'll call it the level funded space, raise your hand if you like health applications and nurse phone calls and those things. For the average broker or consultant out there, it's a non-starter to even get people to complete those things. So what if you can take all of those obnoxious things that you don't like about kind of traditional small, mid-sized group type things and combine them with the things that people do like, right? Ease in quoting, turnaround time, networks, flexibility, and combine those two. And that's really, I think one of the unique things in this space that at least we bring to the table.
I have a Shih Tzu that is harassing my guests. So if
we're all dog lovers here,
if you see or hear that, that's what's going on. I may have to kill him, but we'll see how it works out. We'll introduce him at the end of the show. Go lay down. Hey. Oh, you know what it is? He has a bottle.
Oh, there you go.
And that bottle is probably his favorite toy on earth. So if you want to get rid of the dog, drink that and throw it, and he won't bother us anymore for the rest of the show. But I digress. So I'm sorry to interrupt your flow. You were saying.
Yeah, from a technology, again, like making things appear familiar, right? And predictable.
Yep.
And then using the technology that's available, that in the marketplace to execute on those things and really create a vertical stack, if you will.
Yeah.
No different than, what people imagine today with your legacy carriers, right?
Yeah.
They are the network. They are the provider of the insurance, right? Most of them own their own pharmacy solution. So aligning even from a structure perspective, again, is very impactful.
Well, I'll tell you, one thing that I think is vital is turnaround time, particularly as we're approaching fourth quarter with the vast majority of groups renewing on a January 1, it's being able to your broker clients, being able to turn around a quote quickly and efficiently And I personally find that that's where there tends to be a disconnect. There's just too much lag. And I think the partners that we have that are really good can get it done in maybe half the amount of time that those that aren't quite as good get it done. And that's huge, because at the end of the day, regardless of what the solution is that we're talking about, I think we all have to be cognizant of the fact that while our clients are in the healthcare business, whether they know it or not,
Yeah.
it is not their primary business. And they don't want to be, just gummed up with the minutia. And so if we can't get it done and get back to a client and say, hey, here's a proposal that we have for you. You gave us the data that we requested. And a big piece of this, I think, is that, right? It's just getting a detailed member level census. Do you guys also require access to claims data for a new client? What are some of the things that you normally need in order to do what you do?
Yeah. Well, the detailed member level census is kind of the bar that we need, right? And candidly, for most groups in the size that we're playing on, a member level census is enough to get us there.
Okay.
And we're producing firm rates with that. Now, of course, right, in the end of the day with underwriting, more data is better.
Yeah.
More data can help improve rates, right? So of course, if we can get current and renewal rates, great, right?
Yep.
There's a lot of insight in that incumbent data that is rates.
Right.
Right. If experience is available, sure, we'll take it.
Right.
What we don't want ever, candidly, is health apps, right? So back to your point of, turnaround time matters.
Yeah.
Right? We're all consumers, and you think about everything else that we buy, nothing else that we buy takes 15 days to determine what the price of it is.
Right.
Right.
Right. Good point.
Right. I mean, nothing.
Yeah.
And even if we look across other spectrums of insurance, right, on the property and casualty side, you can go online, customize a quote and have car insurance by the end of the day, right? And be insured.
Right.
And yet that, for whatever reason, has never translated into employer-sponsored healthcare. And so that speed matters, right? And also that accuracy. And so when we think about, how do we deliver ultimately a more, quote unquote, consumer experience from day one, right, with our broker partners?
Yep.
If I can turn a proposal on the same day, and that proposal can go to that client on the same day, and the client can make a decision, not only have I just improved the margin of the agency that would typically take 3 hours to market a group, right? Just to get a group out to all of the carriers, another 3 hours to assemble, a spreadsheet of some sort, right? All those hours add up, right? And they add up for the employer client as well when they're looking for that data. And to your point, our employer clients are not in the business of healthcare, yet it's one of their top line items on their spend. So being able to move quickly, again, puts margin back into all of the quote unquote partners businesses. That is our broker agency partners, our general agency partners, and our employer clients. And that consumer experience, again, carries all the way through to every aspect of what we do.
Yeah, it's huge. It may seem like a nothing burger, right? It's what's the difference if it's a day or a week? It's a huge difference. It's a huge difference because on the broker side of the house, you have brokers that are they're in kind of triage mode. As we get into, I'm going to say mid to late third quarter, coming into the fourth quarter, if you guys are on your A game and you're able to turn stuff around quickly, that's huge, right? But to the average listener viewer who's not in our world, not in the broker world, what's important to them is having a quality member experience. And so talk to me a little bit about that. What is your approach there? And actually, before you get there, tell us a little bit about yourself. Caleb, tomato. What do you go? What does your mom call you?
Mom calls me Caleb.
Caleb. There we go. Caleb. So how did you get here? And tell us a little bit about your founders, because here's another thing that I've learned. You go to these conventions, these seminars, these trade shows in our industry, and almost every time I go to one of these events, there's another vendor that pops up who's new kid on the block. They haven't been around that long. You don't know much about them. And so as a broker, you're supposed to take this new kid on the block and present this new kid to your client as a potential solution. I don't feel very comfortable about that. And I've seen some train wrecks where people who are in the industry have placed a lot of business, a good amount of business with someone in your space, a TPA, a provider, a healthcare bundle, and things go awry and the shit hits the fan, so to speak, right? So tell us a little bit, because this is important, about what's behind Angle Health. Who are I understand your founders have some connection to Palantir, which is, a phenomenal company that is got an incredible CEO. It's loved and hated by the stock market. I handle my own investments and I follow this stuff. And there's also a guy on YouTube. I don't know if you ever came across him, but I can't think of his name right now. But he was like an MIT grad who was one of the biggest proponents of Palantir. And I think he got fed up because the stock price was not reflective of the quality and the potential of the organization. And so he might have cashed in his chips too soon, because Palantir had a huge year last year, and still, and again, I shouldn't speak without having done the homework, because I haven't, but my sense is they still may be grossly undervalued. So an incredible company that's kind of, transparent to most folks, but that is very much an integral part of this whole AI techno revolution that we have. And some of the folks that are founders of Angle they come from that background. Tell us a little bit about that.
Yeah, definitely. So Ty and Anirban are two founders. Both came from Palantir prior to starting Angle, and that Palantir mentality, really does sit at our core foundation. While at Palantir, and Palantir largely works, across a number of different industries, and healthcare being one of them, they saw just how fragmented the data stacks are, right, across all of healthcare. And we look at large payers, and we talk about turnaround time. We talk about these things. It's to some extent, a victim of their own growth and of their own tenure in market, that there are payers that are still paying off DOS terminals, right? Because, again, it works for them, right? And so when they looked at that, they said, like many of the new entrants to the market, this is a multi-trillion-dollar market. We want a piece of it, and we believe that the payer piece is ultimately, again, ripe for the appropriate solution in the market to do what we call a vertical stack, right, or a vertically integrated data stack. And so that really sits at our core foundation of being that claims payer and that underwriting entity, and leveraging technology as that core infrastructure, very similar to, again, a Palantir mentality of how do we take ultimately disparate data, pull it together, and then drive better outcomes, drive better experiences, but also as it pertains to underwriting, right, take, very sort of directionally correct, incorrect data and be able to derive outcomes and expectations, right, which is what underwriting is to some extent. And that's really for us, right, where things like AI and machine learning shine, right? Again, we are not using technology as a structure, right? We're using technology as an infrastructure. And that makes a drastically different approach to, again, us relative to so many others in the market that are, again, shipping new apps, right? Or shipping new ways that people need to shop for their health insurance. Our infrastructure of technology and as an AI native organization is what powers everything and the experience associated with it.
And it's important, in kind of this modern era of AI and machine learning, to be able to leverage those things in an appropriate way, you have to have, an LLM, right? You have to have a data structure that makes sense. And when you have fragmented things of stuff everywhere, you can't effectively leverage modern day technology in that format, right? It just doesn't work.
Right.
You have to have that single database, if you will. And that drives a lot of the pieces throughout the entire healthcare continuum, right? From AI underwriting, leveraging data to have a very precise and accurate proposal. And look, everybody is chasing the renewal, right? Everyone is chasing stability. Everyone's chasing, as I like to characterize it, bending the 5-year cost curve. And there's lots of ways to do that, right? In kind of a 3-part story. But if your goal is to get over here with, a stable, renewable product, you got to start the right place, right? And that is fundamental, Because if you don't get the rates right up front and understand the projected cost and risk, you're never going to get to the end result and the goal of what people are looking for.
Yeah.
Is stability. And we see this in 2025, renewal season, where, I mean, in the markets that I serve, we're talking like 20 to 22% average renewals, especially in the like fully insured small group space.
Yeah.
How does a consultant go to a client and say, good news, you got a 22% increase, right? And the business owner is dumbfounded because they're barely affording the plan today.
Sure.
Now what do? Go to their client and say, pony up, and go to their employees and say, guess what? We're raising the cost to you. You're not getting a 22% raise, are you? No, you didn't. You got no raise this year.
Right.
So it's I call it the death spiral.
Yeah.
And no one's really addressing that piece of the puzzle. And certainly 2025, as I talk to consultants and brokers and employers and even competitors, right? Everyone really struggled in that process.
Well, it's huge, right? Because what you're talking about is this road to the abyss, where we're spending $5 trillion with a T on healthcare. It's just an unimaginable number. And yet, if we look at the status quo players, it's exactly how they designed it. So their shareholders are benefiting from these double-digit increases every year. But for folks that are listening, look, I'm a capitalist. At the end of the day, I love this country, and I want to be the best person that I could be while I'm here. And I'm not I'm not a hard ass that's going to be like, oh, screw you. You have no money. You can't afford the care. Good luck with that. No, folks need care, and they should have access to care and get good care. And, we have federally funded programs for stuff like that, for people that really, don't have. Then we have, kind of the haves that, work for an employer, and most folks get their coverage through their employer in this country. More than 50% get their coverage through their employer or spouse's employer. And for those folks, they are seeing, because unless you're working for a Silicon Valley mega company, right? Amazon, Microsoft, Apple, typically there's a cost share involved. And as these increases happen, a portion of that increase is being passed on to the employee. Think of it from an employer's perspective, though. And let's say you're not a Silicon Valley mega cap company. Let's say you kind of grinded it out. You had an idea, you had a concept, you bootstrapped it, you took your own money, you put it on the line. There were no guarantees that you were going to make it. And you're fortunate now in that you have a team of people. Maybe you have 30 employees, maybe you have 300 employees, but you're grinding and you're doing well and you're succeeding. And now if you have, let's say you have 100 employees, and your cost for health insurance at 100 employees at $10,000 a month is $1 million. If it's $20,000 a month, it's $2 million. And that's a lot closer to the national average, right? If we're talking about blended, single family, et cetera. A 10% increase on a $2 million bill is what? $200,000.
Yeah.
So imagine grinding it. You're doing the best you can. You're working hard. Maybe you're getting paid well. You're driving revenue. But now you have to absorb a $200,000 increase. And let's compound that over the next 5 or 10 years.
Yeah, it's a 100% increase, right? And that is the challenge.
It's
right?
not sustainable.
Yeah, it's not sustainable. So again, like,
how do you address that at Angle though? So what I'm describing is kind of the status quo system, where there's no mechanism for cost containment, and essentially you give your employee an ID card, and essentially you're giving them a blank credit card that says
they run wild.
Yeah, go and get treated as you see fit, as long as you stay within this network. And the insurance, yes, you have your share of the expense, but the insurance carrier is going to pick up the slack. And you came to our studio. Thank you for making the trip from South Carolina and from Arizona, and you came across the country to be here. In our market, we have products on the exchange. If you want a platinum plan from United Healthcare through the New York State Exchange, small business, you have the luxury of paying, I think it's around $80,000 a year for their best plan, a year for family coverage, just to be clear. That's bonkers.
Right.
Yeah, that's rough.
Absolute bonkers. And so we are living this experience, and by we, I mean everyone, where we have been trained to, first word out of a provider's mouth, let me have your insurance ID card.
Yeah.
And that kind of sets the tone, and everything goes from there. And folks, that's a recipe for disaster. So I've always said, like, if you want to fix healthcare in the U.S., the first thing that we need to do as consumers is we need to push back when a provider asks us for our ID card. That should not be the first point of entry. First point of entry should be, I need to see Dr. So-and-so. Maybe it's a specialist. I understand that I have an insurance policy where I have a $75 copayment for the specialist. But by the way, what's the cash price?
Yeah. And I think, it's funny when I talk to brokers and even employer groups and even do, OEs, oftentimes the first question is, give me your insurance card. And I correct the person behind the counter and say, so my name is David, right? Let's start with that. My name is not, what's my insurance card? That's not my first name. My name is David and I'm a patient. By the way, I happen to have an insurance card and I will give it to you. But let's just start with my name, right? And I think, and Caleb would agree that, the success we've had as an organization, and even just in our personal kind of healthcare journey, and we've both been at, very similar places and worked together frequently over the last several years, is the concept of this kind of called a Buca Plus type of solution, right? So, what are those pluses that people like the familiar, they like the card. Providers like the card. They expect the card. They expect the network. They expect the website. They expect all those things. But then how do we introduce low-hanging fruit things, right, that make that journey easier and or attain that goal, if you will, of sustainability, right, over time?
Yeah.
And bending that 5-year cost curve. So those pluses, right, are really important. Again, leveraging to get that rate right up front, fast, some flexibility, some choices, being able to build those pieces of the puzzle. But to your point, Ray, like that middle section, those pluses, those low-hanging fruit cost containment things, those are around pharmacy. Those are around patient assistance programs, alternative ways to pay for things, international pharmacy sourcing, those things that are kind of low-hanging fruit, that are easy, not disruptive. We're not necessarily changing the way people consume healthcare. We're not necessarily saying that you have to access healthcare in a different way, which is for most average employers and most average people, that's very disruptive. No one likes that. What they don't like is the end result, the 28% renewal that they just got. They don't like that. But all the things leading up to it, they like. Right?
Yeah.
So as a platform, right, as a technology platform and as a provider of health insurance, right, as a carrier, how do we introduce those things and make them easy, sustainable? The international pieces, the pharmacy pieces, patient-led assistance programs, right? Where, I mean, look, if you have to do the same thing 3 times and you have reinfection rates when, cost and quality, as we know, is totally inverse in this industry, right? Yep. You pay more, you actually get less, as opposed to the opposite.
Yeah.
So how do we put those easy guardrails in place to help people in their healthcare journey, and at the same time attempt to reduce cost, but keep it very familiar? And again, that kind of plus thing is a theme that we like to bring forefront, right? As we talk to the market.
Yeah, and I think, making it native is so incredibly important, right? You can build the best benefits package as a consultant, right, for an employer, and you can stack 15 different cost containment solutions around it. And then what do you have, right? You have 15 mobile apps, right, for the employee that doesn't know how to use even just their own TPA or own health plan's mobile app. And they're kind of back to square one, which is I've got a plastic ID card and I've got a network, and I'm just going to go where I want to go, right? And so that comes back to the, how do you introduce, AI and machine learning in a manner that, again, is at an infrastructure level rather than a structure level. And what I mean by that is, okay, most people who are going to get a hip surgery, right? You don't just walk into your specialist the next day and say, hey, I'd like a hip replacement, right? Typically, you know somebody who's had a hip replacement. You ask them where they went and ask if the hip's still kicking, and that's where they go, right? I mean, that's the reality of it.
Right.
But the other piece of that is there's also typically, a primary care visit, a specialist visit, an imaging of some sort, back to that specialist, and then a prior authorization. And the problem, in our opinion, right, is that prior authorization is that, that gatekeeping model, if you will, that, look, by the time you're at a prior authorization, you've already picked your doc, you've already picked your facility, you just want to get your hip, right? And so introducing friction at that point of prior authorization, which is already frictionful, you're not going to convince somebody to do something differently, right? And if you are, it comes back to they have the worst benefits, right? And again, they didn't have bad benefits, they had a bad experience. And so our ability to identify, again, at that primary care visit or at that follow-up specialist visit and introduce opportunities to, engage with our members and help them in that care journey and talk them through the various paths that are available for them from a care pathway, eliminate them asking their neighbor who had their hip replaced, a few years ago, how's their hip doing and who'd you go to, and allows us to be that trusted partner in care because candidly, right, most members don't trust insurance.
I laugh, Caleb, because that's not the way to go about procuring the best healthcare. You can't ask your, XYZ who had a hip replacement if they like their surgeon. It doesn't work that way, right? Everybody is different, and what surgeon may be appropriate for a young 20-odd-old who's in superb health versus someone who's got all sorts of morbidities in their 60s. They could be two very different surgeons. And so I think that's, part of the problem with the broken healthcare system is people are just kind of left to their own devices. Here's the network. Here are specialists that you're looking for. Pick a chocolate, right?
Right.
Forrest Gump. You never know what you're going to get.
Sure. And
right?
so much of it's based on trust, right? The reason you're asking the neighbor is because you've lived by them for 10 years. And so you trust them, right? And are they an expert on that? Of course not. Yeah. And yet somehow your trust in them is greater than, the trust you have in, a CMS rating, right? A variety of different cost and quality. And mind you, your health plan administrator that administers, benefits to people all across the country and knows the results of these surgeries.
Yep. Episode of Broken Healthcare Podcast is brought to you by Benefixa Healthcare Consultants. Visit benefixa.com to learn what's possible. Reduce the cost of healthcare for your organization, deliver better outcomes for your people, and yes, design health plans that give your people a path to $0 out-of-pocket costs for healthcare. Visit benefixa.com today. And so help me break it down a little bit. Your plan compared to, I don't know, let's just say United Healthcare fully insured plan. And are you renting networks? It sounds to me like you are renting networks from providers like UHC and Aetna and Cigna, or is there are there carriers that are in and carriers that are out if we're talking about, the big three, or are you kind of actively looking for, always on the kind of hunt for, hey, what can we do to, improve the client experience, reduce that friction experience? And the other thing that you're kind of touching on, and what I'm hearing at least, is that you have cost containment built in, but it is kind of transparent to the end user. So you're working with fiduciary PBMs. If you're working with the big carriers, often the big carriers have, restrictions, and they put you in handcuffs and they say, you could do this, you can't do that. You could do this, you can't do that. So break that down for me a little bit, just in terms of what does the provider network look like? Yeah. And how does the cost containment on the back end work? Because folks, you could have in the same town, I could go and have a hip replacement surgery, total hip replacement surgery at NYU, New York University, Langone on the east side of Manhattan. I could go to Columbia Presbyterian. I could go to Hospital for Special Surgery, or I could go to a freestanding surgery clinic where they do nothing but these hip replacements all day long. the price disparity might be 30 to 35,000 at the low end to 300,000 at the high end. And that's hitting the health plan, and whether your employer is paying that or you're paying it in the form of a renewal, one thing you could be clear about is everyone's paying.
Yeah,
For sure. Yeah.
So, and I'm asking these questions without knowing Angle Health. And so I don't know if you're focused on that at all. And if you're not, you're not. But that's what we're here to learn. So
Yeah.
There's a lot in there. You could kind of fire at
we'll
will.
unpack it in a few different responses. So I think first and foremost, we do believe in contractual reimbursement.
Okay.
And that means that we believe in networks, right? Both national PPO networks and high performance contracted networks. What we don't believe in is that one size fits all, right? For the member that will never use their care outside of perhaps a telemedicine visit or a annual primary care, they want to go just about wherever they're already going, right?
Yeah.
And that's a non-disruptive experience to them. For the member that does have a chronic condition, let's take MS as an example, right? And they're receiving an $80,000 infusion annually throughout the year, of course, right? They want to continue likely going to their existing infusion clinic. Or they may have not known that available for them is in-home infusion, right? And so making available to them, so to speak, the plethora of opportunity for where they can receive care is an important piece for us, right? And that ultimately, if they want to continue to go seeing the infusion clinic that they're already seeing, sure, right? Continue to see that pathway of care. However, let us also be, to some extent, your procurer of opportunity for care. Maybe that can move into your house, right? Does that sound interesting to you, right? Let's make economic decisions associated with that. What's the cost of hitting your out-of-pocket maximum every year at your local infusion clinic versus an infusion at your home that may cost you nothing, right? So building structure around value-based incentive design and incorporating, again, across the board contractual reimbursement. Because when it comes back to friction, whether we're talking about point solutions or chronic disease management or a variety of different care pathways, what we do care about in the end of the day, to come back to that consumer experience, is contractual reimbursement, that the price on the door is the price that you pay, and that there is not a question, so to speak, later on of, am I going to get an additional bill, right? For us as both a health plan administrator, as a underwriting entity, and for our employers and their members, we want to have something that we can point to and say, the price on the door is the price that we're paying. The price on the door that we pay is translates to X cost for that member, and allow them to, again, make informed economic decisions around the care pathways. To answer your question, it's all contractual reimbursement. It is national PPO networks, and it's high performance contractual reimbursed networks, but it is not reference-based pricing.
Got it. So when you say national PPO networks, are you doing business with like a Cigna, for example?
We are. Yep.
You are. Yeah. So what I'm hearing then is that the member has the opportunity to access the Cigna network if that's what they wish. How do you then, I guess wherein lies the rub is, how do you motivate that member to go to a contracted provider where the cost for the surgery, for example, is 30 to 50% less than maybe accessing the Cigna network? Or do you not even get involved?
We firmly believe in, again, providing them options and opportunities, right?
Yeah.
Relative to the cost that's expected of them. And again, allowing them to make economic decisions. Because, to come back to how people view insurance, nobody likes insurance to say you must go here or you can't go here. Right.
Yeah.
And as a result, again, inherently, most consumers of healthcare today don't trust insurance, right? They trust their provider, which, mind you, this is a two-way street, right? And that insurance is providing access, and providers are sending bills.
Yeah.
And there's a whole can of worms to unpack on that side of the house as well, right?
Yeah.
But to that point, we firmly believe that, again, most consumers are going to be able to make educated economic decisions, provided that they're given all of the information, right? If there are 5 car dealerships, right, all on the exact same road, all selling the exact same car, and they have a different price on each of those cars, odds are you're going to pick, the one that has the lowest price for the exact same car.
Sure.
Right.
Sure.
And we, to some extent, have to trust the members to do that. And if they have a reason for, why they want to go to a different dealer that costs more because of a relationship, because of trust, or what have you, then fine, right? And we can allow for that experience. But what we can't allow for is blind decision making.
Got it. So right now, in a fully insured environment, if I have United Healthcare as a provider and I suspect that I might need a knee replacement. My knees bother me. I find a specialist, maybe ask a buddy, who'd you use? I go and see a specialist. The specialist examines me and says, indeed, your meniscus is gone. Whatever. You're shot. You need a total knee replacement. We could schedule you in 3 weeks, or in New York City, probably 8 weeks, if you're lucky, at the hospital for special surgery. How does that experience change with Angle Health, or does it change at Angle Health?
Yeah. If you want that experience, it's available, right? And I think that's very important, right?
Yeah.
That we do make that experience available for the member that wants to go down that path, right?
Yeah.
And they want to go to HSS, right? It's world renowned for MSK.
Yep.
By all means, that path's available for you. Yep. However, as you know, right, as we all know in this industry, it's not as simple as, hey, I want to go get a surgery here and I'm going to put my name on a schedule and it's just going to happen, right? There's a number of logistic pieces in the back end, right? There is the prior authorization and there's the piece before that, again, you're going to get images, you're going to see a specialist. And so at Angle, what looks differently there is our ability to engage with that member sort of following that initial specialist visit, right? To ensure that, hey, there are opportunities for you for care beyond where you think you might be going to care, right? Whether that's because of, again, the provider referral network, whether that's because of, advertising, what have you, we want to ultimately, again, reach out to that member, engage with them, let them know we're here for them. If they want to continue down the path and tell us, I'm not interested and you all engaging, fine, right? Like they're allowed to do that. At the end of the day, they're buying, their employer, right, is buying insurance that's insuring them to be able to go to access the care that they want.
Yeah.
However, to your point, right? If they don't want to deal with that, expensive renewal in the following year, if they don't want, to experience, significant out-of-pocket expenses, what have you, we feel that we have all of the data, right? We are ultimately the purveyors of information to be able to serve that to them to make those decisions.
Yeah.
And that's where that looks differently, right? That's where that AI and that machine learning comes into play, and that most carriers, TPAs, et cetera, are waiting for that point of auth, right? And at that point of auth, that might be when they say, hey, here's how we're going to engage, right? And Consumer Medical is a company that I believe was bought by Alight a number of years ago, but Consumer Medical effectively had 5 cost categories that at prior authorization, if you were at a Fortune 500 company using Consumer Medical, you had to call them, right? Before you were allowed to get your surgery. And Consumer Medical would say, hey, you can go here, you can't go here. And ultimately, of course, it saved the employer money, right? All self-funded plans at a Fortune 500 company. But many members said, well, I want to go where I want to go, right? And the point being there is, what we don't believe is that friction at that point of service is a solution for anything.
The horse left the barn already, right?
Yeah.
It's hard to put the horse back in when it's left the barn. And, there's a fine line in healthcare between like too many choices, right? And I see, and Caleb alluded to a little bit around, you have these kind of Frankenstein plans that put in a bazillion different things. And when I was in the direct marketing world, right, a mentor said, a confused mind says no, right? So if you have 50 different apps and 50 different things, and you got to go here, there, and you got to go this, that, right? Too confusing.
Yeah.
People just revert to what they know.
Yeah.
You know what they know? They know plunking down a card. At the same time, you want to provide an elevated member experience, right? There's technology out there that can alert a guidance system, outreach, if you will, to a member, right? So we kind of take the approach of, do we allow them to function in the current system? Of course, yeah. They want to use their benefits just like they're using today with a legacy carrier. God bless, you can do that, right? Are we going to put 50 different choices in front of them and get them all confused, which I know is another strategy, and then they end up just doing what they're going to do anyway? I think that's a failed attempt too, and we see that oftentimes,
Yeah.
And the funny thing is all these vendors, they get the PIPMs, right? So everyone's making money,
Right.
And they're just putting Band-Aids all over the thing, and no one uses it anyway, right? Or do you take the approach of leveraging technology, understanding that there are things that happened before that prior auth, right? Like we saw the horse in the barn.
Yeah.
The horse was getting groomed, right? Maybe the horse was having their hooves, manicured or whatever, right? So our platform understands those things, and then we can provide customized outreach to that member from an education perspective, right? And that I think is so impactful because what I find in this industry is people are oftentimes never really given all the choices that were out there. They're not, right? Even consultants, they will show what they want to show, right? And oftentimes they're not showing everything.
Or they'll show what they're told to show.
Sure.
And what I mean by that is often folks, your consultant who you know and love, who you go to the game with, or they take you to the Masters if you're a really big client, they're not calling the shots. The person that you have that great relationship with, they are not calling the shots. The shots are being called in the boardroom, and the boardroom, in many cases, is not going to present a plan like yours at Angle, because ultimately it costs their shareholders money because they're doing just fine working in a system that is frankly broken and corrupt, but not for them. And so that's a big piece. So what I'm hearing is you have some pretty well-groomed horses.
Yeah, or at least have the opportunity.
Well, taking care of horses.
Yeah, from a technology platform perspective and understanding there's a lot of things that happen prior to that prior auth.
Yeah.
And being able to engage with that member and at least present some other choices or take their hand and say, look, we're going to help you. Here's the quality metrics. Here's the things that we're seeing. And now you can make a little bit more informed decision around your own care.
Here's what I love is that you're really addressing the number one obstacle to an alternative plan, if you will, and that's friction, right? You're really kind of tackling that head on, and you're not paying me to say this, but in speaking with you guys, that's a big piece, a huge piece, maybe the biggest piece that many alternative to the status quo plans are missing, because no one wants to be told where to go or what to do. Although unfortunately in today's environment, that's more and more the case. Mm-hmm. They want to have freedom of choice and option. And so I think you guys have absolutely nailed that. Are you implementing, or do you have on the radar to implement any type of steerage? For example, if an employer makes a decision to go to a bundled surgery center where the price to the employer is going to be a third, as opposed to going the hospital for special surgery route, and we in this business know that the outcomes are going to be the same, if not better than, in most cases, that type of a setting and environment for many reasons. You go to a big hospital system, you're exposing yourself to infection and all sorts of stuff that you don't simply have in a freestanding surgical center. Is there an incentive for the employee? So, for example, coinsurance becomes a thing when you're spending thousands and thousands of dollars for surgery, and maybe the coinsurance piece is 20% up to a certain maximum, and maybe in the case of a knee, replacement, they hit that maximum. So maybe their deductible is $5,000. They have a $5,000 bill. But if they choose to go to an alternative, which your team is vetted as the quality is as good, so it's not a question of quality, it's a question of price. Maybe the employer says, in this case, the out-of-pocket for the employee will be zero. And so there's a monetary incentive there for the employee, but for the plan just saved $100,000 because that's the spread on the difference that they would pay in a freestanding surgical setting as compared to the hospital for special surgery, and not to pick on them, a large health hospital system, for example.
Yeah, I mean, I think there's a couple pieces there, right? So first and foremost, yes, we do build our plans with value-based incentive design, right? Or VBID from Dr. Mark Fendrick. And look, it works, right? When presented the information that one alternative costs X and the other costs zero, right? In addition to that, again, we firmly believe in contractual reimbursement, right? So we also have programs where we have high-performance contracts that employers are saying in their local markets that these are the facilities that we're going to use. These are the discounts that we have at these, right, through our contractual partners. And on many of those, there's actually no member cost share whatsoever, right? Now, what makes us different there, right, is providing access to national PPOs with traditional cost shares beyond those direct contracts, right? Because again, for the member that wants to access the care that they want to access in the way that they want to access, we firmly believe they should be able to do that.
Yeah.
But for the members that want to make that decision, right, yeah, cost shares are waived, right? For the employer that wants to spend the time to educate the employees on the alternatives that are available for them within that health plan, yeah, like we should reward that behavior from the employer and the employee and their families, of course. And how do you reward that? The easiest way to do that, right, is through economic, incentive design. And the easiest way is to say, hey, look, free, right? And so to answer your question, yes, most definitely. But also to answer your question, we view ourselves as a platform or an infrastructure, right, for the consultants to build what they want to build in that vertically integrated stack, right? So rather than having those 15 mobile apps, right, or those variety of different point solutions, and while they are wonderful, right, they are ultimately very fragmented. And so we view our advocacy team that when an employer says, hey, I want to offer a surgery center program, we view that surgery center program as an in-delivery vehicle, right, or a contractual reimbursement. And our advocacy team is educated on that, and our algorithms are ultimately matching on those member experiences relative to that member that is likely headed down a surgical path to engage, right, early on in that experience, right, and be able to, again, not leave it up to, candidly, a third-party point solution to engage based upon, some file fee that they're getting of claims data or what have you, and they're reaching out. There should be 1/3 to choke, in our opinion, right?
Yeah.
And that's really, again, a huge differentiator when we think about these alternative solutions in the market that, look, you can build a wonderful health plan by adding all of these programs around there. However, if you have 15 phone numbers to call or 15 mobile apps where your members are getting calls from every which way,
It's a drag.
it's not gonna work, right?
Yeah.
It goes back to that
Consumer
confused
experience,
mind,
sure.
says no, and that consumer experience, and leveraging. I joke around, on these pluses and platforms and the way we engage with just building those plans, and plan design has a lot to do with it. And with legacy cares, here's the stock plans, right? You got 2,000 different plans you can choose from, which is fine. Our platform has the ability to offer, we have 18 stock plan designs or something like that. But the consultant knows the group, right? And we're going to give them data, right, as such. But as you want to build those plans, look, if the group has an affinity for using the emergency room as their primary care doctor, right? Okay, well, we can build the plan on the platform, or frankly, our consultants can if they self-quote the thing on our platform. You want to stick a $500 access fee in front of the emergency room? Go for it. Click button here, click button there, the user interface, and you can build in a very modular way. You want to move this program in or move this program out, and fundamentally hit go and produce rates right on the stack. So
That's pretty cool.
Again, as we talk about kind of that Buca Plus philosophy, and the things and you brought up the word friction, right? As we look at just the whole continuum from quoting, building, care management, cost containment, and even the renewals, where are those friction points, right? And if you can successfully remove those, make it easy to quote, make it fast to quote, reduce the things like, health applications and obnoxiousness, put those programs in that fundamentally provide a better membership experience that's friction or frictionless, right, than, those other pieces around it. And then, when it comes to the renewal piece of the puzzle, that's kind of that last piece that kind of, in my opinion, is so important to address when you're running a sustainable solution.
What are you doing about drugs? Are you using Express Scripts or Optum, or are you carving that out with a fiduciary PBM, or do you have one provider using multiple providers? Because let's face it, drugs is 20 to 30% of spend, right, in a plan. So what are you doing there?
Yeah. So first and foremost, we again believe that we're a platform that consultants can build what they want to, right?
Okay.
And so
you're not opposed to a consultant saying, hey, I have a great experience with this particular PBM. Know they do a fantastic job. You can do or accommodate plug and play.
We can accommodate plug and play. However, right, that plug and play also has a price associated with it. Not from an integration standpoint, right? We're happy to integrate anywhere. It's not a problem for us to plug data in, plug data out. But there is a cost associated ultimately with that pharmacy contract, right? And so when we're bringing that in, because again, we're not just a TPA, right? We're underwriting the product, right? As a whole, we're going to say, hey, bring your best PBM that you want to bring to bear, and we're going to price that appropriately, right? And we're also going to perhaps show the pricing across all of the PBMs that we work with, and then allow a consultant and an employer to make a decision based on that, right? Because candidly, right? PBMs in an entirely different world, right? But PBMs are often wrappers upon wrappers upon wrappers of very basic solutions that have a number of different sort of everyone making margin, to David's earlier points on the various PEPMs, right?
Sure.
So can you bring one? Of course you can. Most of our business today sits on Angle RX, and Angle RX, we own our bin and our PCI, so that again, members know, because again, they want that one brand, and that's powered ultimately by a company that's Surpass RX, which is now Lucy RX, and it is a pass-through PBM. And with that comes international sourcing and other pieces and components. So to answer your question, no, we do not work with ESI, Optum, or Caremark. Yes, they are ultimately, as they own a variety of different specialty pharmacies, right? They're in network with these pass-through PBMs, and they are ultimately participating in the pharmacy program in some way, shape, or form, because there's only so many specialty pharmacies, right, in this world. So they do have a piece of the pie, of course. But in terms of how our program's structured, about 98% of our business sits on this Angle RX product that we build exclusively with Surpass RX, now Lucy RX, for our members.
Interesting.
Yeah, and it's again back to that kind of status quo and familiarity. And, it's the same 67,000 pharmacies. That's out there. So it's not like you're ramming something in a limited network.
The member doesn't care who the PBM
They don't
is.
care. That's behind the scenes. They
Yeah.
want to make sure they can go to Walmart or CVS or Walgreens or
Right.
the regional player, et cetera, et cetera. So that's what they care about, right?
Right.
Behind the scenes, obviously, we want to control cost.
Yeah.
We want to bring some of those value adds to the thing, like less than logic or integrated discount card pieces to the puzzle.
Right.
So those are really important pieces. And then
Yeah.
obviously, there's low hanging fruit to be had in pharmacy land.
Right.
And if you have a company that is interested in leveraging those things, like patient assistance programs or
Yeah.
international, et cetera, those things can come to light in a seamless way.
Yeah. Well, yeah, because this is the only industry where no one's checking the price of anything, right? It's really when you have a plan like Angle Health that has the tech behind it, that's kind of doing the work to say, here are the options. Right now, you don't have options in a traditional health plan. You have what you have. If I'm with United Healthcare and Optum RX is the biggest profit center in their business, and it's a pretty big business. If I go to CVS or I do mail order to fill a drug, I've experienced it personally. It's $200 to fill febuxostat. I have gout. It's a 90-day supply, and I could get the same exact medication for cash pay for $35 to $65 going to Good RX with a coupon. I mean, come on. So I think as an employer, what you want to know is that if you have Angle Health, as a provider, if they're your healthcare solution, I want to know that I'm not being price gouged as an employer organization. I want to know my members are paying a fair price, that they're not being price gouged. And there's so many, it's a shell game. There's so many moving parts to this. When we talk about PBMs with spread pricing and rebates and to rebate or not to rebate. So if you feel like you have that piece figured out and that your model does serve the member and the employer organization, yeah, it sounds like you've figured out a bunch of different. You've gotten over a lot of what I see as the primary high hurdles of putting out a good health plan. Number one, again, in my book, is member experience. Ultimately, any employer that's putting out health insurance or healthcare package for their employees, they understand that they're doing it hopefully because they care about their people, but also because it's vital to their business. It's about recruiting. It's about retention. They want to hold on to the good people that they have. They want to attract the best of the best. And a benefits package with healthcare being the cornerstone of that is a huge piece. And so if you have a partner where they're not going to experience that friction pain point And then you have a wrapper that says, we're going to give our members options to access care at the best rates possible, where the quality is highest and the cost is the lowest. You're onto something. And so tell us a little bit about just how long have you been around? What do people think of this? Are they renewing with you, or are they in and out in 1 year? What's that looking like?
Yeah, so the company was founded in 2019. First client or commercialization of the solution was May or June of 21. We've experienced doubling of our membership base every year since that first client came on 21. And I think you think of what are proof points, right? Anybody can tell you, hey, it's a great product, right? Or it's a great solution. And I think the proof points come across a variety of different pieces. The easiest in this industry being, how many clients are you retaining, right? And what are their renewal percentages? For the past 3 years, across thousands of clients, right, our average renewal or our median renewal is 5% or less. And that's in a market where inflation is greater than 5%. Healthcare inflation is significantly greater than 5%. And the average actuary would tell you trends somewhere between 10 and 20%. And wherever you want to agree on that from a trend standpoint, seems to be all across the board at this point. Retaining, well north of 85% of our clients. So the proof is really in the numbers, and the proof's ultimately in our investors, right? We just closed a Series B round. That Series B round was led by the same exact investors that led our last round, right? They're confident in the product and the offering, and they're confident, candidly, in the P&L, right? And why does that matter? Well, we're in a market when not a lot of people in this space are raising, because of those first gen insurtech companies that we all often talk about, whether that be the Oscars of the world, right, or the Brights of the world, and where they have or haven't landed, and individuals' opinions on those, whether they're good, bad, or somewhere in between. But this sort of like the second generation of insurtech that we often find ourselves in is focused on profitability and growth, right? And we're a profitable company, right? And that means a lot, I think, as you think about all of those other metrics, right? 85% retention, the 5% median renewal, and again, raising money in a market where a lot of people are having a hard time raising, all are proof points on, what do people think of it? People think that that seems to be satisfying a need in the market.
Yeah.
And I think all of those numbers are indicative of that.
Those are impressive numbers. Seriously, like that's impressive. And it's an organization that, you're I guess in one sense you could say that it was maybe bootstrapped at the beginning, but you had some real teeth behind you. And this is an organization with tens of millions of dollars invested in it. And I think for an employer, if I'm a decision maker, that speaks volumes, right? Because I've had CEOs tell me point blank, right? The scariest decision I ever had to make was breaking away from a status quo and going with a self-funded solution. And in hindsight, they're thrilled that they make that leap, but it doesn't come, that decision is not made lightly. And there's much consternation involved. It's you feel the weight of responsibility when you literally are responsible for hundreds and thousands of people's very lives, and that's what's at stake. That's what's at risk. So having, I think, the foundation that you shared with us, at least for me, is very reassuring. And so, how do people find you guys?
Yeah. So, we're actively out there on every platform that you could imagine, as far as quoting platforms. We have, great relationships with general agents from a distribution perspective, and certainly work, with thousands of brokers around the country. We've made some significant investments in symposiums and on-site things to educate brokers. And give them, the information for them to feel comfortable, right? I've talked to a lot of consultants. They've never even written, level funded cases, right? They're 98% of their book is fully insured.
Yeah.
So helping educate them just on the principles of, what does level funding look like? And the beautiful part about, the platform that we bring to the table is it kind of looks, smells, tastes, feels, and functions very similar to their fully insured, piece that they have today, which is really important. From
Right.
quoting, from a perspective, et cetera, et cetera. So that's really important for them to understand.
If folks want to reach you, how do they do it?
They can certainly call or email. And
You want to share that?
Absolutely, yeah. David at anglehealth.com. David at anglehealth.
ANGLE health.com.
Yeah, anglehealth.com. Our website is anglehealth.com, and certainly we have a broker section with a form fill, so they can instantly send a message right, to us, and then also sales at anglehealth.com is.
How about you, Caleb? Do you want to talk to anyone, or
Everyone
he
can
shoots some nuts anyway?
just call David.
Just call me,
call
right?
me.
And we'll route you to the appropriate place. We do lots of webinars. We have a fireside chat series.
Okay.
That you can jump on and learn more about the different products and solutions that we bring to the table. But it's about education, right?
Yeah.
And I think to be to transition from a broker, right, or an agent, I often say you need to become a trusted advisor, right? And I tell people that I work with in this space, look, the biggest risk, in my opinion, of not showing a product like Angle, right, is the prospecting broker that is going to show your client.
Sure.
And it speaks volumes as to kind of the growth as we're seeing these things come to play. You're doing yourself a huge disservice if you're not sharing with a client all the choices, and it might not be the best one. We're not a fit for everybody.
Yeah.
And we'll say that, and I'll tell the broker, look, this isn't a good fit group.
Yeah.
Go here, right? I suggest you go that way with this, of whatever the solution might be. But again, being able to show all those pieces, I think it really elevates you as a consultant to that trusted advisor level, just not, a commodities broker.
So you're kind of like Santa Claus and Macy's referring people to gimbals for those Miracle on 34th.
Look, the bottom line is when you do that, if it's the wrong fit, or you can help it, that's going to come back to you in tenfold.
100%.
Right? And I love getting those phone calls, to say, hey, I got this group. What do you think? I'm like, well, let's talk about it.
Yeah.
And maybe it's a good fit.
Right.
Perhaps it's not.
Love that. Well, hey, we covered a lot of ground.
Yeah.
Really appreciate you making the trip out here.
Yeah, thank you.
Thanks for sharing, with the world a little bit about yourselves and with Angle Health. I think you're genuinely onto something here. I think we need alternatives. We need more competition in this marketplace if we're going to solve this $5 trillion riddle. And so I definitely applaud the work that you're doing. I wish you the best of success. And thanks for being here. All right, folks, I think we're gonna call it. Until next time, love always. Take care.
All right, that's a wrap. Hit like, follow, and subscribe, and we'll catch you next time.